If your foot keeps turning in after a stroke, every step feels unsafe. You can't trust your balance, and you're afraid of constantly falling. But what's really happening is it's not a weak foot and ankle. It is the spasticity or the tightness that is pulling your foot inwards, which is the wrong direction, and it is going to happen over and over. But today, I'm going to show you how to reset that pattern and calm down the tightness, the spasticity, and retrain the muscles so your steps feel smooth again. May adlaw na tong tanan. I'm Nathan, I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. Today, we're going to work on the spastic inverted foot, which is a foot that is turning inwards, which usually happens after a stroke, and how you can get it back under control. So most people are told, just walk more or wear your AFO or the splint or brace that you wear on your leg and your foot and your ankle. But let's be honest, if you never reset the spasticity pull, the tightness of your ankle, you will be unable to strengthen the weak side of your foot. You'll always feel like your steps are uneven, unsafe, and not smooth. You're constantly falling forward or sideways. And that's why today I'll show you the full sequence, the release, the stretch, the strengthening, and the retraining of your ankle and foot. So I remember a patient, and let's call him Bobby. He had difficulty walking because his foot kept turning inwards. That was after he had a stroke. Every step was a struggle for him, even with the ankle foot orthosis or the splint that I was talking about, or the brace. He didn't even feel confident. So we worked step by step, not just working on walking. We also did the releasing of the tight areas, the stretching, the retraining of the foot, and then finally we practiced walking. And slowly his steps became smoother. And so if you want to learn what we did with Bobby, let's practice together those strategies and follow along with me. Alright, for this video, mostly we will just be sitting down, and all you need is a towel. So please grab a towel and then come back to this video. You can pause this video for a bit, okay? So just a towel, but we won't be using it yet. We will be preparing our ankle and foot. So for this video, my weaker side, my stroke side should be my left side, right? And it is going to be turned in like this. So when you walk, you are constantly walking on the outside part of your foot. So that is very painful. So a lot of injuries will happen when that is the case. So when you walk, you will be falling to that side, and it's so painful. So we need to prepare that ankle and your foot by doing a massage. So I'm not going to use my left arm, so because I have a stroke in this side, right? So I'm going to just massage the area, the inner part of the calf, all right? You're going to massage going upwards like this, going upwards. So put a lot of pressure on your calf muscle, the inner part, not the outer part, but the inner part going upwards. All right, do that for maybe 1 minute or so. Doing that, make sure that you're going from the ankle going up close to your knee, the back of your knee, like this. All right, that is the tight part of your leg that is causing that ankle to turn in. Okay, and then after that, after a minute, you're going to try to put that foot down. Okay, put that foot down. You can also guide your leg so that it is straighter. So instead of your knee pointing outwards, you're going to bring that knee pointing forward. It will also guide the foot. You can also press down on it, and then after that, you're going to bring your ankle and your foot back where it's behind the knee. You can also just scoot forward from your chair, and you will feel a lot of stretch from your calf. But make sure your heel is going to be flat on the floor as well. If your heel is still off the floor, you're not stretching that calf muscle as much. So make sure that you are pulling your foot back as far as you can where your heel is still touching the floor. Then you're going to lean towards it. So your head is going to lean towards that weaker leg, right? So, and then push downwards like this. Hold that for about 15 to 30 seconds, okay? That is how you stretch your calf. Do this multiple times during the day, please. You will see your foot will start to be in a normal position, right? After doing this for about 15 to 30 seconds, in order to bring this to the next level, remember to bring or to make sure that the heel is still touching the floor. You're going to try to push up into a semi-standing or just halfway standing, just like this, okay? Lean towards that leg. Usually, I see this a lot from my stroke patients. When they stand up, they do this way. They have a bias on the stronger side. Understandable, because you are stronger on that side, which makes that knee overwork, and a lot of my patients will have a painful knee on the stronger side. So, because that is overworking. So let's practice on this side. We're strengthening that leg as well as, most importantly for this case, we are stretching the calf muscle just like this. All right, let's do 3. 1, 2, 3. All right, and that is how to bring that stretching to the next level. Next, let's bring the towel out. So just put it on the floor like that. All right, and then bring your foot on the towel. The action or the movement that we want to do is to do this movement. So we're moving the towel outwards like this. So you're just sweeping that towel outwards. When you get to the end, just bring the towel back and practice this exercise. This will strengthen this side of your leg, which will make the foot more balanced so that this side is not just having a really strong contraction. The other side needs to go stronger. So try to bring that towel outwards. So if you can see, I'm having difficulty moving this towel. That means this part of my leg, the outer part of my leg, is weak as well. So this is a really good exercise for everybody. Our feet are our base, right? So we need to strengthen our feet no matter what condition you have. Even if you don't have any disease or illness, strengthening the feet is very essential. All right, so again, you're just going to sweep or bring the towel outwards from the big toe. This is your point of reference, your big toe. You're going to make sure that that big toe is constantly touching the towel. All right, that is your exercise to strengthen that ankle and foot in order to bring it to a more normal position. So I'm going to show you now the secret in order to maintain and really retrain your ankle and foot to not turn inward so that it is safer for you to walk, to stand up and do your self-care and even do your therapy. Practice your walking, okay? So wait for it. I'm going to show it to you now. All right, so this is the secret move that you need to be doing constantly. If your foot is inverted or turns inwards, you need to wear your AFO, your ankle foot orthosis. I like this one during the day when you are practicing your walking. I am wearing it on my right But like I said earlier, my stroke side is my left side, but I'm showing you two different ones. When you are at home, please wear this. I prefer if you also wear this when you are sleeping, because this will stop your foot from dropping. And when that foot is dropping and it's turned inwards, then it will be more difficult for you in the morning to stretch that foot. Again, you might be sleeping between 6 to 8 hours, even just 4 hours of sleeping or an hour. That's already long time where it's dropping and turning inwards, so it will be more difficult for it to go outwards. Remember, we are just holding those stretches for about 15 to 30 seconds. And compare that to an hour where it's already turned in, then it's harder for you to bring that foot to a more balanced position, right? So wear this during the day, when you're practicing at home, and when you sleep. This has a wedge here that you can insert under this cushion thingy here, and that will help you stretch your foot even more, just even slightly even more. Now this one is what you wear when you are going outside, or when you are, you know, walking towards your doctor's appointments, or when you need to wear a shoe. So this one is thinner, and this should fit your shoe. You might have to get you a bigger size shoe, maybe half a size bigger, in order for you to fit the orthosis or this brace together with your foot. It will be harder to put it on, but I am using this type of shoe. I have been using this type of shoe because it has a rigid backing. So when you're pushing it, when you're pushing your foot forward, it will make it easier for you to do so, right? So let me try my best so that I won't embarrass myself telling you a story, right? So I'm still pushing. You know, ADL, so self-care, is gonna be harder when you have a stroke. I understand that. That's why I'm trying to figure out ways to make it easier for my patients with a stroke to perform their self-care. All right, I'm almost there. Look at this. I'm going to push down. Boom. Woo! It is already in, right? And this is what you use when you need to use your shoes. So that's when you are going outside. I'm going to stand up a little bit to show you what I'm talking about. So since this brace is also long, it's almost my entire leg, well, maybe 3/4 of my calf. This will also force my knee to go back like this when I'm walking. So this will really support my leg when I'm walking if I had a stroke. So please try to get you the proper ankle foot orthosis or AFO. I'm going to leave a link down below in the comment section for both of them. I would highly really suggest that you have both of them. That way you are wearing this during the day at home when you're doing your home therapy, and when you're sleeping, and get this when you need to wear shoes. All right? This is your secret move in order to get your ankle and foot to a more normal position so that you are safer when you're standing and when you are walking. All right, so if you made it this far, type the word smooth in the comment section. That way, I know that you are doing these exercises, these techniques with me, and you are actually the few that are retraining your steps, not just letting it go and living with the problem. So you remember Bobby, right? The patient that I had a long time ago. Once we combined the massage, the stretching, the towel slides, and retraining with the ankle foot orthosis or your splint, his steps became better. He wasn't fighting spasticity. He told me for the first time in years, his walking finally felt smoother and less painful. Mind you, he's always constantly turning that foot in, so it is also painful. So You really don't need a perfect leg to walk smoother after a stroke. You just need to control the spasticity and try to release the tight areas and strengthen the weak side. So if you know someone who is struggling with their walking because of an inverted foot and ankle, share this video to them and you will be able to help them tremendously get over that problem of walking painfully and very unbalanced. And if you have any questions, suggestions, or comments, please type it down below in the comment section. I will do my best to answer all of them, but unfortunately, I'm still a full-time therapist. It takes time for me to answer all those questions. But nevertheless, type down below any of your questions, okay? And just a reminder, consistency is the key and never give up. Until next time, paalam! Zoom!